Hi, my name is Jan Johnson, and I am a successful patient of PRMA. I was diagnosed with breast cancer the week after Mother's Day weekend in 2012, and talk about a shock. Had no idea that that was even going to hit me like a ton of bricks. I went for my regular annual mammogram, and I encourage that for any woman to start doing that every year. Went for my annual mammogram at the Baptist Breast Center and even joked around with them, asking them how often I had been coming in there, and they said for the past 11 years. And I joked, saying, well, if they ever found anything, at least you've got a history. They called me back a couple days later and said, yeah, we need for you to come in. Still in total denial, not thinking that anything would happen because there's no breast cancer in my family. Went back for the scans and got the call from the radiologist to saying, I think we need to do a biopsy. And I should have realized then that something was up, but still in complete denial. And they did the biopsy, and my doctor called me back and said, yes, it was breast cancer. Very early stages. We caught it very early, and I think that's success to having the mammograms every year, but they caught it early, and then started this whirlwind of a journey. You basically wrap up all these emotions, all these stories, everything that you've read in magazines, and all of a sudden it becomes applicable to you. So I started the whirlwind of going to my doctor and being referred to a surgeon, and then sitting down with that surgeon and feeling overwhelmed and being given all these different options of a lumpectomy to a partial mastectomy to a full mastectomy to a mastectomy with the DIEP flap. And at that point, that was the last thing that I wanted to do. I wanted to do whatever I could to save the one breast, and it was only in one breast. After consulting with several physicians, most of them were saying, oh, you can get by with a lumpectomy. I just didn't feel comfortable with that. Just didn't have a peace that it was right. And after praying a lot and seeking some counsel, I went and talked to a friend of mine who had had this procedure and had it done through PRMA. And she said, would you like to see how I look? And feeling embarrassed for her, I said, sure. And she wasn't embarrassed at all. She was proud of the outcome. And so I went and met with her, and she showed me what she looked like after having this done. And I couldn't tell a difference. If I hadn't have known, I would not have known that that was not her original God-given breasts. But I can say I've got God-given breasts from the staff at PRMA. Tried to make some decisions what to do. Make a long story short, it really was orchestrated that I was to come here to PRMA. I was able to get in, have an appointment, got into the room still with lots of questions, still even weighing in the balance whether or not to have the lumpectomy, but wanted to make sure that all of my resources were covered. And Dr. Peter Ledoux walked in with Amy, the nurse at that particular time. And the minute they walked in, I just felt complete reassurance. From the time of making the appointment to walking in here, I felt like I can conquer this. I was not looked at as if it was a death sentence for me. I was not treated with pity. I didn't hear, I'm sorry. Everything was positive and encouraging, and we can do this, and we're here to help you, and whatever you need, and we're your resource, before we even talked about the surgery. So after discussing the surgery and looking at everything for me, it was decided really quickly with my husband and I, even before we left out here, yes, this is what we need to do. But they were wise enough to say, just go home, think about it, pray about it, do whatever you feel like you need to before you make that decision. And so that following week I made the decision and scheduled for July the 25th. So this was about a 2-month process. But as soon as I came here and had that appointment, I knew immediately, and I was ready to walk in and have that surgery the next day. So July 25th of 2012, I had the radical mastectomy with the DIEP flap reconstruction, and I have not looked back since. I was scared, even though I knew that this was the right thing to do. I was scared, but the staff at PRMA walked through every step of it, from sitting down and meeting with us, my husband and I, and telling us what to prepare for and what we're going to have to go through and what you're going to experience to what the surgery is going to be like. Every step. We did not have one question that was not answered, and they made themselves available to us, because you have 101 questions, and the last thing you want to do is go to Google. No, you go to PRMA and they will give you the real answer. So I had the procedure, and the staff at Methodist Hospital were absolutely phenomenal. They deal with patients that have had this. They know it. They've been there. But it's not just a job for them. I think this is just their passion, and you can see that. They treat you as if you are going to make it. And I say I'm not a survivor. I'm a conqueror. And my people that battled with me was the staff of PRMA and the nurses at Methodist Hospital. Got home, and yes, there was difficult times, but nothing that you could not handle. Any questions that I had, the staff was readily available either by email or by phone. I could call and just say, hey, I'm wondering about this, that, or the other, and lots of follow-up appointments, but they made you feel like you can do this. And to wake up after having the surgery and going like this and feeling exactly the same was an incredible experience. You kind of think, okay, am I losing my womanhood? But to feel that, and you still feel the same, that's an incredible feeling. When everything was said and done, and having the procedures and then doing the cosmetic part, now when I look back and I look at myself and the scars are fading, the scars are not fading from my memory, but they're not hurtful scars. They're scars of conquering this. And I look at it as if I had a partner, and Dr. Ledoux and the staff that were here walked me through everything that I needed to go through. And those times that were difficult, which yes, there are difficult times, it's not unmanageable, but there's just things that come up that you're just not used to because you've never had this before. They will walk with you. And I am so blessed to be cancer-free. I'm so blessed to have friends at PRMA that I can even still call now and just go, hey, what about this, what about that? Because you still have questions, but I am complete, I'm whole, I look great, I feel great, I've got a new leash on life. And if this is even something that you're considering, take the time to do your research, not on Google, not on anywhere else, but make an appointment and at least come and sit down and talk to the staff at PRMA, and you'll at least have some qualified information on what you need to do, because you're the only one that can make that decision. Nobody else can make it for you, but they can give you the resources and the tools that will help you make a qualified decision. And I promise you, if you decide to do that, you will not go wrong. And you too will be like me, looking back and helping other people and talking to other people, saying, you know what, you can do this. And you will be a cancer conqueror.